video, I answer a question on how tiny nerves getting stuck to the muscles high up in the neck can cause a lot of headaches and often full-blown migraines. Expect to learn the following: how to tell if headaches are coming directly from the structures in the neck, how nerves get stuck to muscles in the first place, why nerves get very angry when they get stuck, three nerves in the upper part of the neck that commonly get stuck and cause headaches, how to get long-lasting migraine headache relief without injections or medications. For those of you who don't know me, my name is Dr. 𝘭𝘏𝑚𝑎𝑡-𝘭𝑗𝑜. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. The question this week came from YouTube. Let me read it. It says, "I've had horrible headaches that often reach a level 10 migraine status for the past 10 years. I have tried every type of treatment, medication, and even get regular Botox injections to help, and nothing ever works. I saw one of your videos talking about a small nerve in the neck getting stuck and causing all the same symptoms I feel when I get headaches. How could something as simple as a nerve getting stuck cause so many issues? And why didn't any of the doctors I've seen ever consider it?" Thank you so much for sending in that question. And yeah, sorry to hear you've been dealing with this going on 10 years, done a lot of stuff. Unfortunately, I get a lot of these questions each week. And just a quick reminder, if you are dealing with any type of chronic pain from an injury and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I'll be sure to get a video out for you. So the first part is just understanding, is the migraine or the headache directly coming from the neck? A lot of times there's other components to headaches and migraines as well. They can just be hormonal issues. They can be stress issues. They can be lack of proper hydration, stress, all sorts of things. But one thing that I usually like to see, especially if you're going to be in a clinic that's going to try to treat the problem directly with a manual-based approach, which we use in my clinics and all the other clinics that we train, we want to see, before you have one of those like full-blown migraines or type of headache, you actually start to have pain in the neck as well. What that's telling me is that there's some type of structure in the neck that is getting compromised and causing issues, which in turn tells me that those headaches are being caused by that. So if someone's getting a lot of migraines, but they don't get any direct neck pain, a lot of times you might want to check all those other factors. But this person has checked off all those other boxes, and they definitely get neck pain as well. So I'm highly confident that there's something going on in some of the structures in the neck, and more likely some of the higher up ones as well. So the next question people always ask me is, how do nerves get stuck? How do I get adhesion or this stuff called scar tissue? A lot of people think they just have to have some type of accident for this to happen, but that's only like 10% of the time. The most common cause of adhesion and scar tissue buildup is just repetitive overuse. We spend a lot of time sitting, looking down, not moving enough. When that happens, the muscles and the ligaments, they get overstretched. They don't get enough blood flow. They don't get enough oxygen, sends a signal to the brain, and the brain goes, hey, there must be an injury there. So it starts to lay down this stuff called adhesion. It's like a glue that gets inside the muscle and really makes it harder for the muscle to be able to stretch and contract how it's supposed to. When it happens, now the muscle's weaker, less flexible. Over time, though, that adhesion gets bigger and bigger, and eventually it gets stuck to the nerves. So nerves make their way through the body, and they have to start in certain areas, make their way through muscles around fascia, everything to get where they need to go. They're built with like 15% of extra slack, like a rubber band. But what happens over time is that adhesion gets stuck to that rubber band, and now it really jams that down and can cause that nerve to get stuck and create what's called an entrapment. And when an entrapment happens, a lot of bad things can happen. Nerves get really angry when they get entrapped. So basically, the body's number one priority is really just to keep your nervous system healthy, because if your nervous system doesn't work, you don't work. So when the nerves get entrapped, they get inflamed, they start all this whole process of just like numbness, aching, burning, tension. And then what happens as well is when the nerves are stuck around into the muscles, all the muscles around there, they tighten up as well to protect that area. So that tension increases even more and more. And then before you know it, you're getting that full-blown headache. The headache is really the effect of what's going on, but it's not the true cause. So there's three nerves in the upper part of the neck that commonly get stuck and cause headaches. When I like to look at this, I kind of look at it like where you're actually having the headache. So a lot of times if someone's having a headache like here in through this part of the head, like kind of like half through the skull and halfway between the ear, the first nerve that I'm thinking is getting stuck is what's called the greater occipital nerve. And it runs in that area as well and it can get stuck in those muscles. Now, a lot of times when people have like a dead center one, right in the front part of the head, just a lot of throbbing and aching in there. That nerve is actually called the third occipital nerve. And you can see when I put it up here where that goes. And then the last one is called the lesser occipital nerve. And it actually gets caught back through here behind this big muscle called the SCM and through there. And those type of headaches really kind of wrap around the ear and go through there. So a big thing that we always want to know is where is that pain and that dysfunction going? It gives us an idea of like which nerve is getting inflamed. So when I'm doing an evaluation on someone that's had chronic headaches, I'm really asking like, what type of pain do they feel? Does the neck hurt before they actually have the episode? Where in the head is it feeling that? Because then we know exactly where to go. Because I always say, if you don't know where the problem is in the first place, you sure as heck can't fix it. So the most common question I get is how to get long-lasting headache relief without medications or injections. This person's taking a ton of medications. They're getting Botox surgery in there. The problem is all the other providers and the doctors just missed it. They don't think it's something simple, but a lot of times a simple problem can actually cause a lot of complex issues in there. So the first step is really just knowing that it's in there. So it's like getting to a provider that can do a very detailed history, a very detailed functional evaluation, know exactly what's going on with the problem, and then know where to go. Because like I said earlier, if you don't know what the problem is in the first place, you're not going to be able to fix it. Next thing is you got to be gentle when you treat these areas. A lot of providers encounter these nerve entrapments and they actually put a lot of pressure, a lot of tension, a lot of depth on that area. And it hurts like hell when you're getting treated. You think because it hurts like hell that it's actually doing something, but in turn, it's actually making that problem a lot worse. So in order to break this down, you need to get to a provider that specializes in adhesion treatment, especially for nerve entrapments. You need just the right amount of depth and just the right amount of tension. So what I want to link up in the end of the video here is a demonstration of me treating one of these occipital nerves, and you can see how slow and deliberate it is and how focused it is. So I'll link that up right now. And where you're going to go in there is you're going to sink just like that, and then that's going to get your depth as you open up, and then you're going to pull tension straight up. And with this one, you're not going to stand up, you're just going to pull that, and you're going to lean back and pull that through as you go right up to the base of the occiput. So just a couple take homes from the video. You can see how slow, how precise, how focused it is. It's getting the right amount of depth, the right amount of tension, going slow and getting an effective treatment. At the end of the day, treatment should be safe, effective, and durable. If it's hurting like hell, it's not safe. It's injecting you full of poison. It's not getting to the root cause of what's going on. The key is being able to find it, then fix it, and effectively break that down. So that's all I got for you in the video. I appreciate you watching. And a reminder, if you've been dealing with chronic headaches and migraines for, I'd say, at least the last 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us to get set up for an injury consultation to get some real answers as to what's going on and get on the path to long-lasting pain relief so you can stay away from pain pills, injections, and surgeries, which only make things worse. All the information to request a consultation is wherever you're consuming this in our profiles. I appreciate you guys watching, and we'll catch you on the next one. Bye.